Hi everybody, welcome to Healthline. I'm Gregory Zarin. Okay, so it's still summer, the last summer. In August, have you spent more time outside? Have you had those 8 to 10 glasses of water? Have you worn your 15 to 30 SPF sunscreen? Have you turned off your phone, got off your iPad, turned off the TV, and went outside and spent more time with your family and your friends? Have you spent more time in the kitchen with your moms making healthy meals? You know, spring into summer is all about getting up and going out and just doing things differently, getting more active, having a different conversation. So again, our mission here at Healthline is to make you and help you be as healthy as you can be. Live this healthy, happy lifestyle. And within all of that, there's a conversation that communities have, and especially here with us being Adventist Health Glendale and Healthline, we are a community of living healthy. We are a community of conversation. We're a community of doing things differently. And because my history comes from Glendale, it's all about making change. And in the past year, Adventist Health Glendale has seen a staggering change. And that is due to the president celebrating 1 year at Adventist Health Glendale, Issai. And in a year, you've made so much change. Welcome.
Thank you. Thank you, Greg.
In 1 year, you have changed numbers, you've changed goals, you've added so much to Adventist Health Glendale. How does that make you feel within 1 year you've seen all this happen?
Well, obviously, it's been very exciting, a very exciting first year. And I have to say the outcomes have been more than what I was expecting. And I contribute that to a few things. First and foremost, I build a very strong team around me. As you know, running a complex organization is not a one-person job.
And I love that you said team, though. A lot of people think, look what I've done, and you embrace your team, so that's fantastic. You have to.
Absolutely. It's one of the things that I enjoy doing the most, you know, creating robust, high-performing teams, and it just makes our job so much more fun and easier, and you want to come to work and surround yourself with smarter people that are smarter than you and have different backgrounds. So collectively, you know, we bring a lot of good energy and good thoughts and good brain power to make things happen. So I'm very excited about that. I'm also very grateful to our community. I'm the first woman, the first Armenian woman.
You know, behind every great community is an amazing woman. Congratulations.
Thank you.
It's a pleasure. And the conversation has been so much about, first of all, you're the president and you're a woman. That's fantastic.
Thank you.
There's been so much talk about women in power, local, civic, and in a larger scheme. Okay, hold that thought, Elise. When we come back, more with Issai, the president of Adventist Health Glendale, and she's going to share with us what her strategy was and is to come into this community and make a difference for all of us. Get up, take a deep breath in and a deep breath out. Have a glass of water, and we'll see you on the other side. Welcome back to Healthline. I'm Gregory Zarin. So did you have 2 glasses of water, a couple carrot sticks? Did you do some stretching, and are you still taking a few deep breaths in, deep breath in, and a deep breath out? As we started discussing in the very beginning, a year ago, Adventist Health Glendale received a new president, and her name is Issai, and she is here with us today. And we were just talking a little bit about her team and how important teamwork is, and I cut you off because I was so happy and celebrating that there's a woman. And I said to you during the break, you know, there's a powerful woman, and you offered a different word. You said experienced. I love that. Share with me, because then I want to go back to the teamwork, about why the word experienced means more to you than powerful.
Well, again, powerful may have a negative connotation. How do you measure power, right? Mm-hmm. But you can measure experience. And I like to reference that to my almost 39, 40 years of really very rich experiences that I've had throughout 4 large organizations before I landed here. I think the culmination of all those experiences in large and complex and academic settings is what has brought this experience to me. And as a result, maybe that comes across as powerful, but it's really the richness of the knowledge and background experience that's helping me navigate through this amazing organization and set really clear goals. And we saw as a result, we've had many accomplishments this year.
In 1 year.
In 1 year. And if I may, we received our Leapfrog A, which is grading hospitals across the country, our 9 consecutive A that we received.
Congratulations.
The grade comes out every 6 months. So 4.5 years, we've been consistent. And that only 4% of the hospitals in the country received such a grade. Second thing that just happened 2 weeks ago is U.S. News and World Report does ranking of hospitals in the country. There's a big quantitative aspect to it, but there's also a little bit of subjective aspect to it. And based on the surveys they do and the data they gather, we were nominated hospital number 10 out of 133 hospitals in Southern California.
That's fantastic.
And you know, there's big players in Southern
Sure.
California. And hospital number 17 out of over 400 hospitals in state of California. So top 2% in the top 2% of hospitals in the state of California. So that's a huge accomplishment.
Why do you think that is, Elise?
I believe a lot of it has to do, and I like to spend time, a few minutes, talk about the strategic plan
Sure.
that I created. Coming into the organization, as I've gone to any other organization, the most important thing is understanding what is the vision for this company.
So when you, well, let me, you said you've had 40 years in this, in high power jobs. You've had 40 years of experience. So instead of us saying the word powerful, I love the word having experience. With each job or each experience, did you feel it most important to have a strategic plan to go into this organization and say, I want to do X, Y, and Z? So that meant you actually did your homework before coming into this company, this organization.
You can only do so much before you come in because
Sure.
you don't have access to critical data and confidential
Sure.
data. So, but I knew, cursory, and from my experience, I knew it's a good place, and we can go into that if you like. But coming in, I took 3 months just to go around and visit people and really get to know the culture of the organization. Then I engaged into a strategic planning process, a very robust, it took us about 4 to 5 months, very detailed plan, doing a lot of analysis of the market, understanding our external opportunities and threats, and then understanding our internal strengths and weaknesses. And we interviewed people, we interviewed community people, board members, several physicians, employees, and we brought all this intelligence together. And we studied it and said, what is this telling us? And based on that, we developed our 5-year plan.
I love that. So you basically took, this works, that doesn't work, this works, oh, this could work, and you created, as you just said, this plan.
Correct. So what that does to organizations is you have a path. You have a path of travel. You have something that you are
looking toward.
forward, and also making all your decisions based on the plan. So you're not, hodgepodging and guessing. And so on the most part, you stay on track. But obviously, when the track isn't working and you have to make changes on the track. But that's really drives to success. And you know where you're headed. You know where you need to make your investments. Where you need to spend the next dollar for capital, where you market, etc. So that we developed that, and we incorporated many people to take part and provide advice. So I think that has to do a lot with the outcomes we're experiencing. We're also experiencing a great engagement from our physicians. We just finished a survey of our physicians. We had really good participation, over 60% participated.
I love
And 70 questions, so it was a large survey that really measures physician alignment and physician engagement in your organization. And I'm so happy to report, this just came out yesterday, hot off the press, that our physicians in this 1 year, they've gone from 42nd percentile in the country of all the hospitals to this, we've gone to from 42nd to 72nd percentile in the country, that our physicians feel aligned with this medical center and they feel supported by the medical center. I can't ask for a better gift.
Happy anniversary.
So this is now that now we're aligned and more engaged with each other. That's saying that there's trust there. So when the trust is there, we'll just go faster. Whatever is on our plan to accomplish, this trust will help us get to our destination at much higher speed. Trust brings speed, as you know.
And it also brings support. And I love that you say the physicians, and going back to when you said the word team, participated together. Hold that thought. More with Elise when we come back. Don't go away. Welcome back. Joining us is the president of Adventist Health Glendale, Elise Issai, celebrating her first year at Adventist Glendale. Elise, can you give us your history before I ask you a lot more questions?
Sure. Actually, I started at Glendale.
Okay, so it's kind of like coming home.
Exactly.
Welcome home.
Made a full circle. I've lived in Glendale this entire time, but I've worked outside of Glendale. However, I started at Glendale, at the time was called Glendale Adventist, as a financial analyst right out of college, came from Michigan, and then did that for a couple of years, and I moved on to City of Hope Medical Center.
Big fan.
Amazing organization, saves many lives every year. I started, I went there through the ranks of finance and ended after 12 years as VP of Finance. I left and went to the Kaiser system. I was at the Kaiser Los Angeles Hospital, their large facility. I was Chief Financial Officer and Strategy Leader for about 9 years. And then I moved on. I got tired of finance and I moved on to operations, became their Chief Operating Officer, helped them build 400,000 square feet hospital and moved them. That was my last job there. And then I went to UC Irvine Medical Center, a big leap to academic side of healthcare. I was there 6.5 years. It was an amazing career as their Chief Operating Officer. Then I came to USC, Keck USC and Kenneth Norris Hospitals as their Chief Operating Officer.
Big fan of them too.
And then Glendale, or Adventist Health Glendale, recruited me a year ago to be their president.
You are Adventist Health Glendale's first female president. How does that feel?
It feels amazing. It feels great. And I am very grateful to this community, to our constituents. They have received me very well, and I have a lot of gratitude for that, and that just energizes me to really not disappoint them and really further Adventist Health Glendale's mission and our offerings and capabilities to a place that we become destination medicine, meaning that others will travel.
I love that.
They'll travel to our organization to receive care. We have some of that right now. We bring about 150 to 170 patients a month from other hospitals that they need our level of care, and we want to expand that. So when people when they have an issue and an illness or an unfortunate situation, we want them to think of us first.
Sure.
And so the destination medicine is another vision I have for us. There's no reason we can't accomplish that.
Well, one thing people need to also know, though, is in the communities they live in, and if there's, because in our community there's 3 major hospitals, and what I've heard and what I experience for you is it's teamwork. It's really important to be partners with the hospitals in the community. Adventist Health, it's a certified stroke center. It has, out of the Leapfrog, 9 years going out of 8, and all these grades. So it's about finding out what fits best for you in your life and in your family's life.
Absolutely. I think all 3 of us hospitals in our market have a role in our market.
Love that.
It's not that we are going to try to shortchange the next hospital. However, there's a fair amount of out-migration, what we call in our world, in our business world, that leave our market, leave our community, and they go far away to receive care. So really, we want to bring them back to our city and to our hospitals. That's my goal.
Well, it is part of your strategy plan?
It's definitely part of my strategy.
Do you feel, because you have been in Glendale for so long, and that you are a woman, an educated woman with so much history, there's a lot more pressure on you to perform?
I put the pressure on myself,
Great.
actually.
Great.
You know, I am one that I do not like stagnation, and I really thrive on improving year over year. If I've accomplished, let's say, 10% growth this year, doing another 10% is probably not enough. So I bring that pressure on myself, which works both ways, right? It fulfills my goals, but it also helps the organization to thrive.
In the past year, you have made many changes. A huge conversation in this country is healthcare. Ups, downs, high lows, yes, no. What is your vision in regards to Adventist Health Glendale and healthcare and the climate of it?
Definitely, you're right on. Healthcare has become very complex. So we can have hours of discussion on that. But our primary focus is going to be continue our grade A, meaning be a really high quality, have really great outcomes.
Which means make it about the patient.
Making about the patient.
And the
Patient
family.
has to be in the center of everything. And then make it easy and accessible for patients, and make it easy and fun for our physicians to come and practice, because they have choices. Patients have choices. Physicians have choices. So I want them to think of, I want to get care. I like to be at Glendale. And if I'm a physician, it's so easy for me to go and do what I do best. And, you know, be affordable. I mean,
Sure.
that's also another major issue that our population is facing, you know, affordability of healthcare. And again, healthcare has evolved a lot. It's no longer about that inpatient care, inpatient setting. It's all about population health, keeping our people healthy so they don't come to the hospitals. So that's changing our dynamic, that we are a large hospital with 510 beds. So what do we do with that kind of infrastructure? So it's forcing us to really broaden our footprint and start touching more populations, start thinking about how we keep them healthy and away from hospitals. So when you have larger population to serve, when they need inpatient, we still have a place for them to come, but we're now reaching out to double the size of population we were serving. So that's kind of where we're headed.
And what I do love, though, too, is that's the reason for Healthline. We're here to give our viewer and you and everybody else as much information so they don't have to go to the hospital, so they don't have to go to the doctors, so they can be ahead of, you know, do self-exams, see what you're doing, see what your family history is to be as healthy as you possibly can be, to not go to the hospital. Don't go away. More with Elise when we come back. Welcome back to Healthline. I am still Gregory Zarian, and with us for this past half hour has been celebrating her 1-year anniversary at Adventist Health Glendale is President Issai. Elise, a couple words you said that I love. You said you're energized. Instead of saying powerful, you are educated. And in our last segment, you said that you want the doctors to have fun. Tell me more about that, because I was like, wait, do people really hire doctors in to have fun? What is that? And was that part of your strategy when you came to this hospital?
Well, you know, doctors are under tremendous amount of pressure.
They are.
Right? And the last thing you want to do is not having the capabilities or the ease of things that they have to do in the hospital. So that's something in our control, and we can make it happen for them. So I really take pride in that, to partner with the physicians. And that's one thing that I really have focused on.
Which goes back to teamwork.
Goes back to the teamwork, exactly, and alignment.
Love that.
And having them part of the decision-making process and part of setting our goals and strategies for our future. So, and when I say fun, you know, maybe that's a little bit, you know, too simplified, but have it easy for them when they come in, when they do the medical records, when they're ordering tests, when they have to work with certain
Look forward to
equipment.
coming to work.
exactly.
Which is fun. I mean, and here's the, I've said to many doctors on this show, you save lives. We were talking earlier about some of the about the departments at the hospital, and we've had him on Healthline, the head of the emergency room, Anthony Cardillo, and he has always said, because I said to him, I said, do you feel like you're God? And he says to me often, patients want us to be their God. And he said, all I do every day is come into my department and do the best I can with the best team that I have. So it sounds like the same mission, to make it a really great partnership with everybody that you work with.
Our jobs are pretty complex, right? We have so many constituents that we have to address and deliver results. But if you can have that fun and laugh in between things and enjoy what you're doing,
it takes off some of the pressure.
You will not achieve your results. It will be pressure. The culture will be more a tense culture in the hallways of the hospital, and you don't want that.
You don't,
because it reflects through our caregivers and nurses, and reflects onto the patients. And their jobs are to make it so fear-free for the patients. And if they come in from a place of being tense
and anxiety,
they will not deliver that comfort that they have to deliver, whether they're respiratory therapists or they're physicians or nurses, etc.
Adventist, we were talking earlier about the leapfrog, and all these awards and how well the hospital's been doing, and in the past year has done. There are many departments. We've done shows on breast cancer. We've done shows on heart health. What are other divisions in the hospital that people need to know about?
Let me start first with our emergency room. I'm
Back to Anthony Cardillo.
really impressed with our emergency room. We do about 60,000 visits a year, and this past year we hired over 300 nurses in our organization. So our throughput has improved, and our physicians are telling us they see a difference. Patients aren't waiting, patients aren't leaving without being seen, and then when they need a bed, it happens quicker than ever.
You also communicate. I was there a year and a half ago with my twin brother for something, and you have the concierge that is communicating with everybody. Because if you're in an emergency room, you want to be seen. Mm-hmm. You're panicked, you're worried, you're afraid. Somebody is being addressed all the time, which I think is really important for people to know.
Absolutely. And then, if we start looking at different services,
sure.
What we call the departments, there's several that rise to the top, and we're very proud of. We're very proud of our orthopedics services.
Big fan.
It goes from everywhere, shoulder to every part of the body you can imagine, including spine program. As it relates to neurosciences, which is neurology and neurosurgery, we've actually was one of our high-performing areas in U.S. News and World Report, both orthopedics and neurosciences. So that's also very powerful. As a result, with the Comprehensive Stroke Receiving Center, we do over 700 strokes a year, and we bring patients from many hospitals and emergency rooms. Our cardiovascular program is amazing. We have talented cardiologists on our team, cardiovascular surgeons. Another thing that I think sets us apart from a lot of our competitors is our specialized surgeons. We have multiple specialties.
Love that.
And that we've recruited this past year in colorectal, in GYN oncology, in breast, vascular surgery. So we bring all this expertise that really a lot of times is above and beyond the community hospitals. So I'm proud to say that we're more than a community hospital.
And one thing I want to add too that I threw out there is mental health is such a big conversation right now, and the behavioral health unit at the hospital is amazing. And also you have an off-campus drug and alcohol location. It's GADS, Glendale Adventist Alcohol and Drug Services, which saves many lives. So it's more than just this one hospital. It's this vast campus that does so much more than one would think happens in a hospital.
Yeah, the mental health, as a very good example, it is very comprehensive. It goes from outpatient to inpatient, back to outpatient. We have a 60-bed mental health
which is amazing.
unit, inpatient unit. And then, as you're familiar with the GADs and all the outpatient setups for pre and post, or just for outpatient.
Inpatient, outpatient, all of
So
it.
that makes it very comprehensive. So it is a great offering for our community.
You must be so proud of the community that you get to call home. What is your wish for everyone in this community in regards to their health? Final thought.
My wish for our members of our community is to take care of their health, especially as it relates to smoking. You know, we are a big city with a lot of smokers, so I hope they would start there and take care of their health. And if there's an unfortunate situation that they need health care, we are top on their mind, and we're comprehensive, and we have many things to offer that is very impressive. It reminds me of the big academic medical centers I've been. We're nothing short of them, except perhaps transplant and some very, very high-end specialized oncologic surgery. So I want us to be available for our community. I want our access to be easy. When they come to our doors, we greet them with smiles, and our customer experience, the customer experience they'll have will be superb.
And what is your hope?
And my hope and desire is that I'll be here for many, many years and continue seeing the surgical plan to its full fruition. And as I said, will be a destination medical center for our many communities around us and from distance. They'll come and choose us for their health care.
Will you make me a promise?
Yes.
You will meet me in a year from today.
Absolutely.
And we can see how much more you've done.
Absolutely.
Thank you. It was an absolute pleasure.
Thank you for an opportunity.
No, it's great having you here. And again, an educated woman in charge of this amazing hospital. Okay, how great was that? The most important thing I gathered from all of this is health, wellness, and asking a lot of questions, finding out where to go, where the best place is for you and your family to go. And you just heard from Elise, Adventist Health offers so much more than you may even know. Find us on social media at AH Glendale on Facebook, Twitter at Adventist Health, also at LinkedIn Adventist Health, and you can always find more information on the website, AdventistHealthGlendale.org, and you can always find me at Gregory Zarian. I say this all the time, and I'm going to say it again. The most important conversation you're going to have is about you and your health. So why not have one right now? Give someone a hug. We'll see you next time. Take care.